This should have a great thing.
Hello, everyone. This is Dr. Carrie Bedient from the Fertility Center of Las Vegas, and we're back for another episode of Fertility Docs Uncensored. I am joined today by my two simply lovely co-hosts, Dr. Abby Eblen from Nashville Fertility Center
Hey, everybody. It's great to be here.
and Dr. Susan Hudson from Texas Fertility Center.
Hello, how are you doing, Carrie?
I am fine, thank you. And I was just thinking about the fact that even though we are all incredibly data driven, and this is not just like the three of us, it's also
Yeah,
pretty much everybody that
society.
we spend all of our time with because of because of where we spend all of our time in the clinic, that doctors and also people like in the surgical specialties or procedural specialties, there are things that even though we are super data driven, there's superstitions or quotes or aphorisms that we all live by, even though they may or may not make any sense. And so I am curious, what are the things that you guys, what are the tiny little inconsequential things that you guys live by?
Oh my gosh. When it comes to be about March or so, I'll look in my closet and think, maybe I should wear those white pants, or maybe I should. Oh, no, wait a minute. It's not Easter yet. I can't wear white before Easter. To this day, I still live by that. I don't know why, but it's just stuck in my brain. I can't get
I,
rid of it.
I have to say that's one that I like. I will sometimes break the rule, but I do struggle with it. And for my husband, if he grabs his corduroy pants after Easter, I'm like, oh no, you can't wear that.
How does he respond when you do that? Does he
It's like, okay,
like he doesn't fuss at all? He just like rolls his eyes and picks another pair?
let's put it this way. We are about to celebrate our 25th wedding anniversary, and my husband has not bought his own clothes in about 29 years. So I pretty much hold the trump card for all things fashion wise.
Yeah, ironically, my husband, it's one of the few things he defers to me. He'll ask my advice on what he wears sometimes, which is rare for anything else, but he does for clothes.
That's awesome.
So what about you, Carrie? What do you live by that's not evidence-based?
Um, so there's a couple quotes that always come back at me when someone shows you who they really are, believe them.
Mm-hmm.
Which
Oh,
is not evidence-based, is not, it's more like oh, so you don't think people can change. I'm like, no, that's nothing to do with it. It's if they tell you who they are right now, you let them be right about telling you who they are. Um, there was another one that one thing that gets said a lot around our house is only boring people are bored. And
Mm.
so anytime anybody around me says I'm bored, I was like, oh, well, you must be boring then. Um, I also notice I never step on cracks. Like step on a crack,
Mm.
break your mother's back. Don't ever do that. Those are just kind of some of the random things. Like I always have the exact same routine going into the operating room of how I scrub my hands and which one I
interesting.
start with, how I do it, how many ups and downs I do on each finger, all of those things, which there's
So you're a
no
little
evidence.
OCD about that?
Uh, I prefer to think of it as CDO because it's alphabetized and less being
Alphabetized, exactly
organized.
the way it's supposed to be. I'm with you, girl. I'm with you.
Yeah.
Yeah, it's funny. Like whenever I get new staff in my clinic and they're learning how to do like procedures, whether it's an IUI or a saline ultrasound or a regular ultrasound or whatever it is, I'm like, I am so crazy methodical in that I do it exactly the same way. I mean, I glance up at the same time. I move my
Yep.
hands in the same way. It's crazy, but I'm like, once you get used to what I do, like you can know exactly what I'm going to do because I'm so like this is how it's going to happen. Yeah.
See, I
Yeah.
put that right up there with it when you put your dishes in the dishwasher. Like if you put them in there in my book, they get clean, but other members of my house have to like put them in a certain way in a certain order every single time. So that's kind of the same. So I'm guessing you're one of those people like my husband and not like me. Susan, is that right? You're
Oh
methodical
yeah.
about
Like, there's a certain way to like I
there
can
is a certain way.
if the dishwasher gets started before I'm home, like I'll be like, okay, they got clean. That's fine. It's not the way I would have done it, but that's all right. But yes, if I'm like I in my household, I'm like, y'all unload, let me load because I can definitely make more stuff get in there than anybody else.
So there is a meme that I have seen several times that is something to the effect of, in every relationship while loading the dishwasher, there is a Swedish architect and there is a meth-addled raccoon. In
Hey,
my
I don't like that analogy, Carrie. I'm offended by that. I'm not the
I
meth
think
addled
Abby's the
raccoon.
raccoon.
I am the
So
raccoon.
when it comes to dishes, I'm the raccoon in my relationship.
Good. I'm glad there's a raccoon, two
Yeah,
raccoons,
yeah.
and
No, my husband is entirely the
the Swedish
architect, and
architect.
yeah, and it may or may not be the raccoonness in me may or may not be exacerbated by the way that he redoes every time I do it, and so now I deliberately do it cockeyed and inefficiently, because I am occasionally a terrible person. But yeah,
Sometimes I do it just to push buttons. I'll just put him a little sideways to see what he does.
uh-huh, uh-huh, yes,
Y'all
So
raccoons
you don't
next.
know this, Susan, but your
are
husband does that
mean.
too. All right.
All right, so what questions do we have today?
All right. So our first one is, hello, doctors. I found your podcast earlier this year, shortly after experiencing a miscarriage at 6 weeks, her first pregnancy. During that time, I experienced the most emotional pain I had ever had in my life, but your podcast offered me a sense of comfort and hope that pregnancy is possible. So thank you so much. Thank you so much for writing to us.
Yay.
Now for my question. I'm 28 and had a miscarriage earlier this year. During the ultrasound to confirm miscarriage, there was an 8 centimeter cyst that was found. I got another ultrasound 7 weeks later, and the cyst is the same size. I have not had any symptoms, pain, heavy period, and I've had a normal period cycle every 28 days. My doctor recommends I get the cyst removed. I am actively trying to get pregnant and would love to hear what you think about having surgery. Thanks.
Did we get an age on her?
28, and the cyst is 8 centimeters.
Okay.
That's pretty
My
big.
vote, my vote would be I'd take it out. It's just my rule of thumb, and I don't have a lot of evidence-based medicine. But if it's over about 4 or 5 centimeters, that scares me. I'm worried that it's going to pop open in the middle of the night, and you're going to have some stranger doing your surgery in the middle of the night that's half asleep potentially. And I just feel like a cyst that big, it's kind of like a bomb kind of waiting to go off. You can have a torsion from it. I just don't feel like it's good. And, we don't like to operate on the ovary because when we cut into the ovary, it can damage some of the normal ovarian cells. But if it's 8 centimeters, your ovary's like 2 or 3 times the size of normal. It's so stretched out. I mean, there may be a little bit of ovarian tissue left there. And if you go to the right doctor, I mean, most reproductive endocrinologists could save some ovarian tissue from that side. Any ovarian tissue would be good. But if it were me personally, I wouldn't want to be walking around with an 8 centimeter cyst because I would worry about rupture or torsion.
A lot of my decision is if you've had, so I'm not sure if you spontaneously conceived your pregnancy that you had your miscarriage. And if that happened, we really have no idea how long that cyst has been there. And so I would, if I don't know how long it's been there, then I would probably say, yeah, at 8 centimeters, I would probably have it removed. Now, if you were a fertility patient during that time and you were having scans and 3 months ago you didn't have that cyst, then I would more consider it if it's a clear, simple cyst, not looking something like an endometrioma or have any like funky things inside of it, then maybe draining it could be an option if it hasn't been there long. But if there's no way for me to know how long it's been there and it's still here 7 weeks later, um, I think it is potentially something that is innocuous but could lead to complications that you don't want to end up with. Carrie?
Yeah, I would agree with that. I mean, in the absence of any symptoms whatsoever, you may be a little bit more willing to wait, do one more ultrasound in another month or two. But the problem is if you get pregnant, your hormone levels are going to go high naturally. And if that cyst grows and if it ruptures in pregnancy, nobody likes operating on a pregnant woman. Nobody. And so, we can do it and we try and preserve elective surgeries until like the second trimester when you're in that sweet spot. But if it ruptures, like you go in when you got to go in. And so I don't know. I'm leaning a little bit more towards taking it out before you actively get pregnant. But in the
Yeah, I
absence
mean,
of symptoms, you could technically not do anything with it either. It just makes me
I
kind of
definitely
anxious.
I definitely think the trend over the past few years is a little bit of laissez-faire, like leave cyst alone. But I do think there's a time and place when some cysts just need to come out. We don't want to
Yeah.
watch them. And the other thing too, even if you don't get pregnant, say you go back to your OB and maybe you don't have an appointment for another 6 or 8 months or 10 months, there's not going to be people watching it as closely as they are with the fertility doctor too. So I just think there's a lot of unknowns, and it would make me nervous walking around with an 8 centimeter cyst.
Yeah.
Let's do our next one. Hello, thanks for the podcast. I'm learning so much. I'm 37 and struggling with secondary infertility. I'm gearing up for IVF and cleaned up my diet and have stopped drinking alcohol. I still drink coffee. What is the rule with caffeine? I've heard mixed information. I don't drink coffee excessively, but probably 2 to 3 8-ounce cups per day. No bad stuff, sweeteners added. Thank you.
Well, that's a good question. Coffee and caffeine you're right, there's mixed information out there. Some of the information says like 200 milligrams a day or less is fine, which is assuming you're making your coffee at home and not getting like a quintuple espresso from Starbucks. That's like you're well under the threshold of that with a cup of home brewed whatever. And coffee or caffeine can also be found in chocolate and, sodas and things like that. So it's important to consider it from all the angles where you can get it. But generally 200 or less is considered to be okay. There are some studies that suggest that no matter how much caffeine, you have a higher risk of miscarriage. But yeah, I mean, there's perfection and ideal, and there's living your life. And if you do not function without any caffeine, nobody's going to fault you a cup of coffee.
I generally say less than 200 milligrams a day.
Yeah.
And
That's what I say
think
too.
most normal cups of coffee, you're going to be able to have about 2 of those. So you may want to bring it down from 3 to 2. I'm a huge fan of not drinking energy drinks. Like,
Yes.
if you're trying to get pregnant,
Yes.
energy drinks just seem like a really bad idea
Yeah,
on
agree.
multiple levels. So like, I mean, it sounds funny being, have preferential caffeine sources, but I would rather you have some coffee and a soda or something than having an energy drink. It's one of those that it's like, there's just so many chemicals and everything in those that I'm just like, it just gives me the heebie-jeebies.
And I think those energy drinks, I don't drink them, but I think they have at least that much, right? Some of them even have more than that,
A
don't
lot
they?
of them have like at least 300.
Yeah. So, I mean, yeah. And you worry about if you're
Pre-workouts,
all the other
dehydrated.
stuff
you need
they
to
add.
watch for those too, because a lot of pre-workouts have a huge dose of caffeine.
Ah,
Realize
interesting. I didn't realize that.
because it's coming from a natural source like
Doesn't mean
ginseng
it's
or
good.
whatever, it doesn't necessarily mean it's good.
Yeah. Good point.
Yeah. All right.
All right.
So our topic today is going to be all of the myths of intercourse and getting pregnant and all of those things, which is always a highly entertaining episode to us because we get to go through all of the things that really are kind of random and not necessarily data
But they are things that people worry about. I mean, we hear these questions and these
all the
comments
time
about intercourse and ejaculate and
Uh-huh.
timing and all those things every single day. So it's not that we're making these things up. And if you have these questions, you are not the only person who is asking them. Everybody else is asking them. That's why we're like, okay, here's your answer.
Yep. Okay, so let's start with the first one. And does position matter when you are trying to conceive?
Position does not matter if you hit the target.
How do you know that you hit the target? Like, what if you need to be upside down?
If you are having penetrative intercourse.
Right, and that's the key.
Penetrative in the vagina,
intercourse.
not anywhere else.
Right,
That's right.
in the vagina. So if the penis is in the vagina and
It's
there's a
working.
ejaculate that happens, like that's all the positioning we care about.
That's right. You don't have to stand on your head. You don't have to like hang from the
You don't have to
ceiling or the
pop up.
chandelier.
Yeah. No headstands.
Do you have to put anything under her hips to keep her up at an angle?
No.
You don't, although some guys do have more ejaculate than others. And so sometimes I do get the question, well, after we had sex, some of the ejaculate's coming out. Do I need to worry about that? Well, most of that's just fluid. Most of that doesn't contain sperm. And in fact, the sperm really that is going to be helpful gets up in your reproductive tract within about 30 minutes or so. It gets in pretty quickly. So probably most of that fluid that's coming out doesn't have a lot of sperm in it.
Yeah. And I mean, when ejaculation happens, and even though you said 30 minutes, the really good sperm are like busting it up into the uterus. So, when we're worried about those little swimmers who are like dragging their feet in the vagina, I wouldn't be too concerned about those.
Mm-hmm. Does it make a difference with the timing of intercourse? So for example, and there's a bunch of layers to this particular one. And so one thing that I have people ask me is they say, I really want a girl, for example, or I really want a boy. And so this means that I should time intercourse differently, right? So if I want a girl, I should time it in like the 4 or 5 days before ovulation, versus if I want a boy, I should do it in the 1 or 2 days before ovulation. What's the rationale and the truth behind this?
You need IVF with PGTA if you want to pick
Yeah,
the
sure.
gender.
You know, even before IVF could choose the gender for you by doing that, there was something called flow cytometry where they would separate out boy sperm versus girl sperm and give you potentially a little higher likelihood of having boy sperm. And even with flow cytometry, this like, you know, basically this thing in a lab, it couldn't really separate out the sperm. So the when you have sex really doesn't have any bearing on whether it's going to be X or Y sperm that's going to get to your egg.
And if there are any statistical differences, you are making the difference of 1 or 2 percentage points, not something to like paint the baby room with.
Exactly.
Exactly. Okay, so let's talk about other timing issues of, for example, do we need to have sex every single day?
No.
We do not.
When do
And
you
if,
need to have sex? Like if you figure someone's cycle is 28 days, which are the days, and let's say she ovulates on day 14 and she's pretty reasonably reliable, day, 14, 15, somewhere in there. Does she need to have sex days 1 through 28, or can she get by with less?
she can get by with less, and she can actually, usually what I tell my patients every other day, if you ovulate, usually around, you know, day 13 or 14, usually day 13, day 15, day 17, and it's better for the sperm there to be waiting on, or better for the sperm to be waiting on the egg than the other way around. And I always like to, when I give talks about fertility, I always talk about this study published in the New England Journal probably 20 years ago, and they timed when couples had sex. They had couples record it. They got urine from the woman every single day, starting like 7 days before ovulation and 7 days after. And essentially, what they showed, the majority of couples got pregnant when they had sex right around the time of ovulation up to 24 hours after ovulation. But I think the more interesting thing, or the most interesting thing, is some couples had only one episode of intercourse 5 days prior to ovulation and still were able to have a baby. Now, generally, you want to do it right around ovulation, but what that means is sperm can really survive in the reproductive tract quite a long time.
So, kind of the general rule of thumb that I go by is that sperm are generally going to survive for about 72 hours once they get up inside the uterus. So, when we recommend every other day, that's giving you some leeway in case somebody gets home late from work or somebody gets sick. You know, you got a little leeway in there, okay? And the other thing, kind of on the whole, like myths and legends, storing up sperm. Okay. So
Yeah.
don't store it up. Okay. And what we're meaning is that sperm, if the male partner has not ejaculated for essentially about 7 days, the sperm start to break down and release chemicals called free radicals, and then those start hurting the good sperm. Okay. So generally what I recommend is if you're really trying to focus around the time of ovulation and you have 28-ish day cycles, usually start around day 10. Let's clean out the pipelines. Do 10, 12, 14, and 16 so that you have some that are there just in case you ovulate at a certain time, because your egg only survives about 12 hours after you ovulate. So it's important to have something in the system, and then towards the end of your fertile period, and then the rest of it's for the fun of it.
Excellent. When you are having sex, does lubrication matter? And particularly outside lubricants like, your KYs and your all these other ones that are available.
A lot of the spermicidals will have some sort of thing that kills the sperm, basically. I mean, a lot of the lubricants will have spermicidals in them. And so you really don't want to use things that you buy over the counter, although there's a few that are geared toward couples. I think, I'm trying to think of, Pre-seed, yeah.
Pre-seed's the one
Pre-seed.
that's around.
I generally
Yeah, there-
recommend pre-seed or canola oil. Those are the two that I know that have good data. I have a question for you guys because I have a lot of patients nowadays who are using coconut oil.
Uh-huh.
Is there any data to say yes or no on whether that's a good idea? You know, again, I think that falls into the it's quote natural, and so everybody
Yeah.
thinks it's safe. And for something that like goes from solid to liquid relatively easily, I don't always think that that's such a great idea when we have sperm, but I don't know.
I don't know. I don't know any data on that. Do you, Carrie?
Give me
Any
a second.
coconut oil
I'm
data?
pulling it up. While I am looking for this, do you have to have an orgasm to conceive?
Nope. Completely unrelated.
Yeah.
Yeah,
That's part of
but
the fun part, not the fertility part.
having an orgasm will not decrease your
No.
rates. Okay. And so looking at, here we go. Coconut oil can temporarily relieve vaginal dryness and discomfort, but can interfere with your vaginal natural self-cleaning process. Oh, this isn't actually helpful. This doesn't talk about sperm. It just talks about
Self-cleaning. That sounds like an oven.
I think to me that sounds like it's
Yeah.
gonna mess up your like vaginal pH and bacterial
Well,
flora distribution.
maybe it has sugar or something. Maybe it has some sort of sugar in it that could make, yeast proliferate or something. Who knows? Natural
Yeah.
sugars.
Uh,
Sugar in the vagina is not a good thing.
yeah. Oh, this is gonna be a rabbit hole that
That's all right.
Oh, well.
We'll find it some
Um,
other time.
Oh, here we go. Might negatively impact sperm motility. So no coconut oil. There we
All
go.
right.
Okay, so do things like the color and quantity of the ejaculate matter? Because I have a lot of guys who come in and say, yeah, it seems like it's a lot less than what it was before, or it's white now, or it's clear now, or it's insert color here now. And if it's green or if it's red, so it's bloody or looks infected, go get that checked out right away. But how about the other more benign ones
And
like clear?
we're going to back up with that because go get that checked out right away. Honestly,
Yeah.
if you call your reproductive endocrinologist and say, I have blood in my ejaculate, like as much as we deal with sperm, us dealing with a potential
Infection.
infection like that, we are probably not your best source. Okay. And so that's really when going to see a urologist is going to be, I always say that it takes a village, and the urologist is part of our village. And sometimes we need them to help us on situations like when that happens. Or, when you're talking about quantity, my opinion is too much is not a problem generally. But if you've been gradually noticing that you're having less or you have no ejaculate, that is something we need to check out, because you may have retrograde ejaculation or some other kind of physical blockage that isn't supposed to be there. And again, we may be enlisting our urology colleagues with that as well.
One thing I would say about infection is our lab, I know when somebody comes in and leaves a specimen, if they have more than 1 million cells there, that concerns us a little bit. It may be benign, it may just be immature sperm cells, but it could be white blood cells, and it's hard to tell the difference. So we automatically will do a sperm culture. Now, one of the things I've learned from the urologist recently is even if a guy has a positive sperm culture, if he's asymptomatic, a lot of times even the fertility urologists don't automatically treat him. Now, if it's a situation where we're doing insemination, and this is sort of the debate I got in with our fertility urologist, but yeah, if we're doing insemination and we know that there's germs in the sperm, we don't want to put them up in the uterine cavity. And so in that situation, I think most of the time, most urologists would agree that, yeah, even if a guy is not symptomatic, but he has an excess amount of germs in his sperm or bacteria, then he probably does need to be treated, certainly before IUI anyway.
Yeah. All right. So next myth is here we go. That stress doesn't impact whether or not you're able to get pregnant. True or false?
It depends. If it's physical stress or psychological stress, sometimes it can keep you from ovulating. So in that situation, it can. When it comes to other types of stress, we don't really know.
I want to say that I am more a believer of acute, unusual stress having an impact than normal, what I call chronic everyday American stress,
Mhm.
that, it, yes, we're seeing decreased fertility rates, but I don't actually think that stress is the number one cause of that.
Yeah.
Although stress can affect things that I do think are like unhealthy eating, less physical activity, weight gain, those types of things, which definitely can contribute, and stress that just
Mhm.
makes you put off having babies. We're definitely continuing to see that the average age to have children is going up year by year. And so when you're under stress and it feels like I can't take on another, thing in my life, like it's one of those indirect things, but not the directness that it feels like.
Okay. How about men don't have a biological clock? True or false?
False.
How
False.
come? What happens? And when does the clock break?
Those epigenetic changes in sperm.
So, what Abby is referring to is as we go through life, we can see that certain genes can get turned on or off abnormally due to life experiences, whether it's medications, exposures to chemicals through alcohol, nicotine, drug use, whatever, or just, physical, like things you experience in your environment, that we see that fertility outcomes do decrease. I would say we start seeing those to decrease around the age of 45 to 50. We know that men who are over the age of 50, I believe, their children do have an increased risk of autism and some other medical conditions. So, yes, men do not have the same, you know, they don't have the same extent that it does with women. I mean, the chances of getting pregnant, in your mid to late 40s with women is highly, highly, highly unlikely if you're using your own eggs. Um, and yes, there are men who conceive into their 80s and 90s. But the quality and sometimes quantity of sperm
Mhm.
do decrease. Um, and so
Okay. How about being on the pill for too long can make you infertile?
No, I mean, generally, the pill actually can be protective against certain types of cancers like ovarian cancer and colon cancer. Generally, it just impacts you when you're taking it. When you stop it, your system generally just kicks right back in and to whatever system you had before. So if you had irregular cycles and were diagnosed with PCOS, you may have normal cycles for a month or two after you go off the pill, but once it completely gets out of your system, then usually you go back to the way you were before. So it just keeps you from ovulating during the time you're taking it, but doesn't really have any long-term impact on your fertility. Now, your age does. And so if you've been on the pill for 10 years from the time you're 25 or say 28 to 38, and you go off the pill at 38, then, 38-year-old women just don't have as good a fertility as
but it's
28-year-old
not
women.
because but it's not because
And
of
it's
the pill
not because of
itself,
the
it's just
pill.
because
Yeah.
of normal ovarian aging, and your
Yeah.
ovaries age at the same rate whether you're taking the pill or not. I've got one, for the guys. My testosterone is low, and I need to take testosterone to protect my sperm.
Myth. Don't do it.
Total
Resist.
myth.
Testosterone has been investigated as a potential birth control agent for men, and it's not made it through all those approvals because it's not reliable and it's not always reversible. And so it won't make everybody infertile because it'll stop their sperm production. But there are going to be enough people where it does stop their sperm production and getting it started again is really hard. And so
Yes.
if you have low T levels and you are trying to get pregnant, for the love of all that is holy and spermatically
Sure.
produced, do not take testosterone
There
until
are
you are,
other medicines you can take that
yeah.
can
Right.
help you endogenously within your own body raise your testosterone levels, thus improving your sperm parameters. But if you take testosterone pills, patches, injections, pellets, there's sometimes irreversible damage.
Not all the time, and sometimes we can get back, but just don't do it thinking you're helping that particular aspect of your life.
Mm-mm.
Yes.
How about boxers versus briefs for sperm?
Well, I guess the theory with boxers versus briefs is if your boxers are really tight and they hold your testes really close to your body, it heats your testes and it can kill sperm.
Or
So
briefs.
briefs.
Yeah.
Yeah. So we generally say boxers are probably good. I mean, unless your underwear is really tight, it probably doesn't make that big of a difference. But if you want to be on the safe side, wear boxers.
Avoid the hot tub though. Just
Yeah,
avoid
avoid
the
the
hot
hot
tub.
tub
And
Avoid
the
the hot
sauna.
tub. Avoid the sauna. Like
and the testosterone.
and the testosterone.
Yeah. How about foods impacting fertility? Meaning, if you go out for date night and have oysters, you are more likely to conceive.
I think oysters are just supposed to make you more motivated. I don't think it actually affects conceiving. I mean, we always, I just got asked about pineapples, and there was something else.
McDonald's French fries.
Oh, McDonald's French fries is a classic one. Realistically, it might help something. It's not going to probably hurt something, but I don't think that the magic pill for you getting pregnant eating hearts of pineapple is probably not reality.
Mm-hmm. How about the one that smoking is fine as long as I stop when I'm pregnant?
Oh, that's a huge myth. Oh my gosh, smoking smokes your ovaries and smokes your eggs. And so, sometimes we can see women in their mid 30s and their ovaries are, they have about as many eggs as somebody in their mid 40s because of smoking. And so, it depends on the length of time you've smoked, what you've smoked, the quantity of what you smoke. Smoking is just bad, though. It's bad for everything. It's not just your ovaries, but everything.
And I'm going to clarify, it's bad for sperm too. It causes those epigenetic changes.
Yep. Yep.
And when we say smoking, that is a catch-all for all nicotine use. I don't care if you're vaping, chewing gum. There was something else that I saw something recently, another method of consuming nicotine. Nicotine is nicotine. It's bad for eggs. It's bad for sperm. I always tell people, I'm like, I'm really, really good at helping people achieve pregnancy. Nicotine use and getting rid of it is the number one thing that you can do that's going to help you out.
And let's not forget marijuana. Everything that's legal, even if it's legal in your state, doesn't mean it's good for you. And so, we've known for many years, and this was a long time ago when I first started out. I remember the people who trained me said, "Oh, and if people smoke marijuana, their sperm tends to be really misshapen and malformed." And we see that. I mean, we tend to see morphologic changes. The shape of the sperm is abnormal. There's not a lot of studies yet, so that we know really much about what impact it has on the DNA. But
Can't
I
make a
can't.
good randomized controlled study about marijuana use and trying to get pregnant. Just not
Yeah.
quite ethical.
Exactly.
Yeah. All right, let's do one more. Myth that my mom got pregnant when she was into her 40s. I'm going to be just fine.
No.
I wish that were true.
I mean, we do see that there are some families where people do have extended fertility lifelines. Okay. But I wouldn't count, your mom or your aunt or your grandma's experience to directly play into yours. I mean, this is not exactly fertility related, but I can say I fell into this trap as a young person starting my family. I'm an only child. When my mom was pregnant with me, she started contracting at like 6 o'clock in the evening, got to the hospital, got her epidural, watched her 8 to 10 movie, and then pushed. I was delivered by 10:30 at night. I never thought I would have an issue with anything. And I sit here with 3 C-sections. Okay. So, like, I understand how easy that trap is to be like, oh, my family never had, actually nobody in my family had ever had C-sections. And so just realize that your biology is your biology and not necessarily mom or auntie's.
Yeah, and my mother had me at 40, but I have 2 kids from IVF, so there you go. Doesn't always hold true. And what you don't know is the issues that your partner brings to the table too. And so that's something. You may be the most fertile person in the world, but if your partner doesn't have very good sperm, that may be an issue.
All right. Any other myths that you guys can think of that we have not yet gone through? I think we hit a lot of them.
I know, but if our listeners come up with any, if you think of any, this would be another great show. These are fun shows to do. I like doing these shows. So think of some other myths and send them in. We'll be happy to address them.
Yes.
All right. So to our audience, thank you so much for listening. Be sure to tune in next week for more. Be sure to subscribe, leave us a review in Apple Podcasts and Spotify and all the places. We love hearing from you. We're on Instagram, Facebook, YouTube. So hop on by, leave us a like, a hello, a follow, and say hi.
You can also visit us on fertility.suncensored.com to submit questions. All questions will be answered on our Ask the Doc segment anonymously and leave us some episode ideas. So don't hold back. We love to hear your ideas.
As always, this podcast is intended for entertainment and is not a substitute for medical advice from your own physician. We'll see you all soon. Bye.
Bye.
See ya.